Hi, I'm Dr. David Clark. We're very excited to introduce the new TSS matrix system by Bioclear. It is tooth and surface specific. It's an anterior matrix system for the maxillary arch from canine to canine, and then for lower incisors, we have mandibular matrices that are specific to those teeth. Let's take a look together at the kit and see how the kit is laid out. You're going to see matrices specific for tooth number 6, mesial and distal, 7, 8, 9, 10, and 11, canine to canine. We have a small and medium lower incisors. That's a universal matrix, and then the small and medium diamond wedges. We'll go ahead and open up some of these boxes and show you how to use these great matrices and wedges. So let's talk about some of the tricks and tips to have success with the TSS matrix. If the contact is intact, which is great, it's very helpful to come in with the True Contact Sander by Bioclear and go ahead and groom the contacts. In fact, before a rubber dam, we'll go ahead and groom all the contacts from canine to canine so that the rubber dam comes in without tearing. This is a safe-sided True Contact Sander, so it doesn't damage the tooth, it just smooths the contacts. The next thing you can do is to come in with the orange True Contact Sander, and we don't do IPR per se, we come in and gently lighten the contact so that the matrix can seat. Sometimes you won't need to do this, but usually you will. Gently sand the contact. Do not open the contact, gently sand it. And then for cases where the contact is very tight, you could come in with the coarse True Contact Sander, up, down, buccolingual, to allow the matrix to seat fully. The next thing that we find extremely helpful when we're inserting anatomic mylar is to take this Clark Explorer and gently pry the teeth apart and drive the matrix in. The next tip is to use a rubber dam. The rubber dam does a beautiful job of adapting the matrix subgingivally. So you can see that the rubber dam is doing a beautiful job of making sure that the matrix stays tucked into the sulcus. Okay, next tip. Sometimes you can change the overlap of the matrices to make the fit a little bit better. So let's change that. In this particular case, the distal was not as well adapted. So if we come in and basically rearrange the overlap, in this particular case, it looks a little bit better with the mesial matrix outside of the distal. And once again, we want to make sure that the matrix is fully seated all the way into the sulcus and gently into the long junctional epithelium. Look at that adaptation now. So the combination of arranging flanges of the matrix, having a rubber dam to help tuck it into the sulcus, driving the matrix completely subgingivally, gently into the long junctional epithelium, that's a great way to adapt the matrix. Let's go ahead and place the diamond wedges for an even more secure fit. So the first few times that you're using anatomic mylar, you'll have to get used to this whole aquarium business. So what we find is very helpful to come in here and then open up the matrix to inject the etchant. And then you can use, I like to use a stiffer brush to come in from the top to apply adhesive like this. And then of course, same thing from the palatal. You'll just have to come in from this end. If we're placing flowable composite, same thing. We open up the aquarium basically and inject the flowable this way. And the same thing here. You can also use an explorer if needed to open up the matrix to inject the composite materials in. And the same thing when you're using the paste. So when we bring in the heated paste material, we'll go ahead and sort of unzip the aquarium. We inject left, right, displacing the flowable composite. And then the aquarium closes up nicely for you. Here's another clinical tip. Especially if you're not using a rubber dam, sometimes when the matrix comes in, it's not in the sulcus. So let's go ahead and demonstrate what that would look like. So I'll pull this matrix back out, and let's say that the matrix is sitting, out here. It's resting on the gingiva, and the more you try and seat it, the bigger the problem that you have. So you have a couple of choices. You can try and direct the matrix back into the sulcus, but depending on the tooth, Sometimes the matrix is simply too long on either the palatal or the buccal flange. So what you can do is get a pair of these Bioclear scissors. You can come in and shorten the flange. You can shorten the flange both gingivally and mesiodistally, and that can aid in making sure that the matrix slides into the sulcus. Now, once again, if you're using a rubber dam, it typically guides the matrix into the sulcus nicely for you. Another clue that the matrix may need to be trimmed, and usually you have to trim either the palatal or the facial flange, is when you press on the matrix, if you see the matrix bow away from the tooth like this. If you see the matrix bow away from the tooth like this, that's a clue that you may need to shorten the flange. Once again, the flange can be shortened in the gingival aspect and also a little bit mesiodistally. So there's a nice little trim, and then that should allow the matrix to seat fully with less of that sort of bowing effect. So now as I'm pushing on the matrix, it's not going away from the tooth. So there will be some times that you'll need to either trim the facial or the palatal flange, both gingivally and mesiodistally. We're going to take a look at a tooth that's got deep caries both on the mesial and the distal of tooth number 8. And let's go ahead and grab the corresponding matrices. And in this case, the medium diamond wedge would be the best wedge for the case. So the best thing is to grab a sterile pair of cotton pliers. And I'm going to grab the mesial, and then I'll come around and get the distal. And then we'll grab a couple of medium diamond wedges. Perfect. So in this case, we've got caries on both the mesial and the distal. I'm going to slide the matrix in. This is the 8D matrix. You don't want to push too hard on the incisal. You want to pinch it or squeeze it or brace it against the tooth and then drive it gingivally. Now here's the 8M. Each one of these matrices is tooth and surface specific. So I'm sliding this down, squeezing it, bracing it, pinching against the tooth. Don't push too hard on the incisal. You can bend the mylar. You can gently push it here, but squeeze it apically. Whenever possible, we like to use the diamond wedge. I'll bring the diamond wedge in at about a 45 degree, kind of like a suture needle. It creates a beautiful adaptation of the matrix gingivally without collapsing the matrix. It's much less traumatic than a wooden wedge. So we'll come in once again at about 45 degrees under the contact. And now you can see the adaptation of both the matrices and the wedge. You'll notice that the cingulum and all of the anatomy for the first time, it's amazing. All of the anatomy is built in for you. You could literally inject a composite in here. I squeeze the matrix gently, light cure. This is going to change the placement of composite dentistry. Let's just take a minute and look at some of the other shapes that you'll see in the kit. We'll go ahead and start with this tooth number 7. Let's go ahead and grab a mesial and a distal. So for example, here's the 7M. We'll drive that into place. And 7D. Once again, each matrix is tooth and surface specific, so you do need to make sure and use it on the correct tooth. Once again, press gently if you're going to press on the incisal. You don't want to overly bend the matrix. The best way is to grip it, squeeze it, drive it apically. Now, let's go ahead and compare the small and large diamond wedges. Here's the small. Now for the posterior kit, the Evolve kit with Bioclear, we have several other wedges, much larger wedges, but typically in the anterior, the small and medium wedge will be the most commonly used wedges. So here is the medium and the small diamond wedge. You'll be using the medium much more often than the small, but if you have root proximity, you'll be using the small wedge. Let's do one more example. Here's the 9 mesial and the 9 distal. Let's go ahead and get a 9 mesial and a 9 distal. So let's go ahead and place the 9 mesial. And then the 9 distal. And then let's go ahead and place our diamond wedges. There we go. So what are the indications for the new TSS tooth and surface specific matrix by Bioclear? We're going to want to use this for pretty much any class 3, class 4s for broken teeth, and we can also veneer a tooth. By simply adding more volume when we put the composite in here, we can push the matrix out about 1 millimeter and actually do aesthetic veneering.